I'm Vivian Vasallo, the Executive Director of the Delta Dental Institute. Welcome to the third installment of our conversation series. Today, we'll be talking about oral health literacy. Last year, the Delta Dental Institute published a white paper examining the state of oral health literacy in America and its impact on oral and overall health outcomes. This paper assesses health literacy gaps and evaluates how improvements can enable Americans to make more informed decisions about their oral health. In today's discussion, we'll cover the fundamentals of oral health literacy, look at programs promoting oral health literacy, and hear about the latest updates in the field. Joining us for this discussion are two nationally renowned leaders in this space, Dr. Nicole Holland and Dr. Maria Ryan. Dr. Holland was one of the authors of the white paper on improving oral health literacy. She's an assistant professor and director of health communication, education, and promotion at Tufts School of Dental Medicine. And Dr. Maria Ryan is vice president and chief clinical officer of Colgate Palmolive, where she provides oversight and leadership to dental and dermal clinical organizations. Thank you both for joining us, and let's dive in. Dr. Holland, let's begin with the basics. Oftentimes when people think about literacy, they think about reading and writing. So tell us, with a basic definition, what is oral health literacy and why is it essential for our overall health outcomes?
Thank you. I'm glad you asked that question because people do really think about reading as what health literacy entails, and it's so much more than that, and it's so important. The health literacy field, I'm going to step back because I think the definition of health literacy really informs where we are in the oral health literacy space now. So health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information and services, and use that information to make appropriate health decisions. So within that, we have there's a lot of good nuggets that's within that definition, but essentially what the biggest takeaway is that health literacy is very functional and it's very actionable. And like Vivian said, it's certainly beyond the ability to just read. And so I think when we think about what that means for oral health literacy, the definition of oral health was implanted into that and integrated. And so that's how we got the current oral health literacy definition. In terms of the most updated definition of health literacy, Healthy People 2030 actually just published a new definition of health literacy, which I think is important because it is reflective of the changes that have taken place in the field. We have started to recognize that health literacy is not limited to the level of the individual. So we now need to think about the systems, just like the tooth sits within the context of the mouth, which is within the human body. Similarly, individuals exist within the context of the healthcare system. And so therefore, we're now starting as a field to think of health literacy at a more systems level and think about it from an organizational, institutional standpoint. So the Healthy People 2030 definition actually broadens that scope. It still includes that personal level of health literacy, but it also includes the organizational piece, where we're thinking about what can organizations do to equitably enable those individuals in order so they can make and inform themselves and their family members. So that's the biggest piece of the definition. Why does all of that matter? Well, it matters because research shows that health literacy impacts health outcomes. So when we think about health literacy, we know the data shows that low health literacy results in poorer health outcomes and lower utilization of services, healthcare services. So from a dental standpoint, we can think about, just by way of example, health literacy can result in a decrease in or reduction or avoidance of dental care, or that can potentially further itself to resulting in what could be a routine dental problem turning into a more serious dental emergency. Similarly, we know research showing that medical and dental terminology can be very confusing, right? Jargon can be very confusing for many. So Essentially, from an insurance standpoint as well, dental benefits also can be very confusing, and the way that we use those can be confusing, and how, what they mean and what does that mean for my family and so on and so forth. So obviously that can be a significant barrier in terms of being able to utilize those services appropriately, even if you have adequate coverage. So that's why it matters. That's why we care, because health literacy clearly has a direct impact on health and utilization of healthcare services, obviously leading downstream to then affecting health outcomes.
Thank you for that comprehensive definition as well as distinction. And I think it's important to note that it goes beyond the individual, that it really is around the system, and that here on this call we have different representatives from the academic community, from the private sector, from the dental benefit community. Dr. Ryan, I was wondering if you could expand. You've been in this field as a researcher for many years. You certainly represent the private sector. And I recently read that 90 million Americans have low health literacy, and only 12% of Americans are functioning at a high health literacy rate. And given what we just heard from Dr. Holland on the importance of this, can you share with us a little bit more about what Colgate Palmolive is doing and some of your experience with your programs connecting oral health education to children and to different communities across the country? And I know that you're also global in your scope.
Well, obviously at Colgate, we really take oral health literacy very seriously. I mean, not only as an employer of, 36,000 employees, but, for people throughout the world, we feel that we have to not only improve on oral health literacy for our consumers and even with the professionals that we interact with and other stakeholders. And we have, penetration into 60% of all homes. So we have a real opportunity to share this message with lots of people. And we are certainly doing that. We have actually a website, which is the number one branded website called the Oral Care Center, which really provides information on oral health, and it targets you throughout all of your life stages and provides key facts on common issues that people face and other helpful tips for oral care. And to be quite frank, in this age of misinformation, it's really important to get out good information. And we feel fortunate that consumers and dental professionals alike see Colgate as a real trusted source of information. We've been around for over 200 years and really consider ourselves a leader in oral health globally. And so we see this trust as a real valuable opportunity as a brand to really bring the information forward. But I think that, we spend a lot of time telling people about the importance of oral health. And, we have a number of different programs. As you mentioned, in children, we have our Bright Smiles, Bright Futures program, which is an educational program which really focuses on improving oral health literacy in children. And the earlier you start, the better. And as Dr. Holland said, it takes a village. It's not just providing information to those children, but it's also engaging with their parents and caregivers, engaging with their teachers, engaging with other health professionals, whether they're dentists, hygienists, nurses. Nurses are really good at sharing information, and also physicians. And so we have to really bring all of those elements together. But one of the things that we've been thinking about is in creating behavioral changes, which are really necessary to improve oral health. It requires a two-way dialogue. And so, as people know about their IQ and their EQ and how that's important, in trying to develop and move yourself forward and have a healthy and a happy life, and people understand how they may try to change that. And there are lots of books written about it. How many people know about their OQ, their oral health quotient? And, I think asking the question, what do you know, instead of us telling them what they should know, and assessing where they are for their OQ can be very helpful. And how can you improve that? And why does it matter? I think once people understand these connections that we talk about between oral and overall health, it will prioritize oral health. I think that when you think about, do people actually know that prevention can help them to not have the most common chronic conditions in the world, caries and periodontal disease, and something as simple as brushing twice a day with a toothpaste with an active flossing and using mouth rinses can be very effective preventive strategies. Do they know how to access the information that Dr. Holland's talking about, so that they can learn more about the importance of oral health, about insurance policies that are available, about how they can find a professional to help them to assess their oral condition. And I think that's part of your OQ, right? Do you know these things, and how can we provide you with that information? And how can we improve on your oral health literacy? So I think it has to be a two-way dialogue, because I've been around a long time, Vivian, you're right. And I've been talking about the connections between oral and overall health, the importance of oral health globally. And yet, if you think about it, we are often talking to ourselves. We have a lot of people who want to make a difference, who want to move this forward, but we have to empower the consumer. We have to empower people throughout the world to really seek out this information and really work with us to improve on their oral health literacy. So, and at Colgate, we really take this very seriously, and we have the opportunity to really better inform consumers.
I just want to follow up, because you talked about the trust, which is so critical, as well as the two-way exchange, which I think we often forget. We're often talking to people and forgetting that exchange requires listening. We're in this pandemic where there's a lot of information overload, if you will, right? Every day you're getting messages, and sometimes they're conflicting, and sometimes they're conflicting from trusted individuals. The CDC says one thing, the FDA says another. Your doctor doesn't know what to tell you. How do we take this experience and translate that from whatever hat we wear, whether we're a policymaker, a philanthropist, a dental insurance provider, a consumer-facing organization, a community-based organization? What are some key takeaways from the exchange of information over the last year and a half, and how can we translate that to oral health?
Well, I think that the pandemic has been very interesting, as you see these influencers, and sometimes people who don't really know a lot about things really influencing people. And we have to really work very hard to make sure people get accurate information. And I had an interview the other day with a reporter who said, you just told me 50% of people over the age of 55 in the United States have periodontal disease. He said, why isn't everyone talking about this? And that this can impact their overall health. It can increase their risk for diabetes, for cardiovascular disease, for adverse pregnancy outcomes. And I said, well, maybe it's not as sexy as it needs to be. And he said, as a journalist, we're trying to learn from these influencers how we can get people like Dr. Holland, like you, Vivian, like myself, out there and have people want to engage and learn more about this. So I think that's very, very important. I also think that the pandemic made a situation that was not great even worse, because it really put oral health on the back burner. I mean, when the pandemic first emerged, if you recall, the announcement came out that going to the dentist was not essential. And so they closed down all the dental offices. I remember watching this thinking, have you never had a toothache? It's not something you can take care of by yourself. And as people started showing up in the emergency rooms with swellings and pain and discomfort, and many emergency rooms are not equipped to manage dental emergencies, suddenly it became very apparent that oral care was essential. So I think a very positive thing came out of the pandemic, in that there was a recognition that this is an essential service, that oral care needs to be addressed even during a pandemic. and that people actually started to think more about their health and think more about the science and look for accuracy in some of the messaging coming out. So I think it provides us really with an opportunity to elevate oral health at this point. I mean, JADA put out an article that the #1 unmet health need for children during the pandemic was oral care. And so, you know, what we saw happen during the pandemic, I think elevated the message that we're trying to deliver here. And I think we need to really jump on that and really move this forward at a much quicker pace. And I think the pandemic is doing that in certain areas, helping us to move things forward more quickly. And I think the integration between oral and overall health is essential. And I think that this is an opportunity to really move that piece forward.
Great, well said. Dr. Holland, I want to turn back to you. You co-authored this paper before the pandemic, and there were some recommendations that came out of that paper. I was hoping you could highlight some of those findings, but also reflect on, do they still hold a year and a half later, given where we are? And are there any other recommendations that you would have? I know in particular in the paper, you did address the different sectors and different roles that we could have in that system. So if you could just share with us again, some of those findings and recommendations and your input on how they hold up a year and a half after pandemic.
Sure. They do still hold up. And a lot of it is, Dr. Ryan mentioned a lot of them. So the paper we looked at, you know, what can we learn from what we know of health literacy and apply that to ways to improve and enhance oral health? And so with that, some of the 3 main recommendations that we had were to, you know, create a provider network of health literate dental settings. Right. So in thinking about what that could look like, make sure all staff, your dental team, everyone that's going to be involved in this dental experience for the patient, make sure that they're trained up in health literacy best practices from the provider side. And again, more than just the individual, more than just the patient, and creating, again, these dental homes. So making sure everyone's trained up with that, potentially involving after visit summaries, you know, into your routine of a practice in your dental office. The second one was improving capacity for integrating dental practice. So Dr. Ryan spoke about the medical dental integration, and specifically we were kind of thinking about, you know, the referral process, right? So, and by integrating the medical dental integration, you know, what is a referral process for a patient? We know that many patients do fall through the cracks. So really establishing and kind of fostering and nurturing that relationship with our medical colleagues, with our behavioral science colleagues, and making sure that the patients, there's follow through, these structured referrals that happens with our colleagues for the patient to have continuity of care for whatever that scope of practice may be. Another example could be the electronic health record. Obviously communication with various providers, but also from a patient standpoint in terms of thinking about, we did touch on social determinants in the paper. So maybe the electronic health record is a way to kind of catalog some potential social determinants as a point of discussion for the providers to the patient, potentially having zip code information. Some epidemiologists will tell you that the zip code, right, is a greater indicator of lifespan than your genetic code potentially. And so what does that mean? And how can we utilize electronic health record in those types of discussions with our patients in an educated and informed way, obviously not stereotyping and making certain assumptions based off one zip code. That's also something that needs to be stated, but potentially what is the use for that? How can we better utilize and integrate fully our dental offices within kind of this overall healthcare system? And then the third one really was to create and test patient education materials and employer educational materials that are in plain language, potentially have various language access capabilities that haven't been there before, from translation into knowing your service area, what are the languages that are spoken where you practice, you know, translate them in the top 3 to 5 languages, more if you have the capacity to do that. But plain language documents that, again, are used for education. I think the employer piece is one that's interesting as we think about the use of dental benefits, what they are, what they cover, discussed that a little bit earlier, but, you know, potentially are there explanations that employers can use to explain what the dental benefits are, so people can then be informed and pick one that will be best for them and their family and their loved ones. So those were some of the key recommendations that came out of the paper. All of those do still apply very much so currently. What I will say is in the paper, we did provide a list of resources. One that I think is very timely to this discussion is a toolkit. Because again, back to recommendation 3, having oral health, dental related specific information for our practices and our field. With that, there is a toolkit that came out from UC Berkeley in California in collaboration with the California Department of Public Health Office of Oral Health. And it's specific for oral health literacy and dental practices. Exactly what I was saying earlier, is evidence-based. They have done research on this, they have tested it, and now they're ready to roll out for practical implementation by the practices. So I would highly recommend that as a resource as well. And I think overall, the key takeaway from the paper and what we can learn from health literacy is that, dentistry as a profession, we need to look beyond the individual clinical encounter if we're going to make headway in this space, and really kind of broaden our scope and our perspective on what it is that we can be doing. That does need to be backed by evidence. It does need to be data driven, and it needs to be financially practical for all involved. So finding ways to make it doable, but looking beyond the one-on-one interpersonal encounter. There's so much more to be said of that as we think about equity, as we think about, as Dr. Ryan mentioned, just the fact that the pandemic really exacerbated the inequities and inequalities in this country from a healthcare standpoint in many ways. And so how is it that now, as we kind of come to the other side of that, can we have these lessons learned from other disciplines and use those in oral health in order to better what we're trying to do in our field?
I think all great points that you've made. In particular, some of those takeaways will certainly highlight links to the toolkit, because I think sometimes it can feel overwhelming to hear these recommendations and not be connected to the resources. So we want to make sure to do that. You talk about some other examples, and I wonder for either of you, as you think maybe outside of the oral health field, are there some examples of effective communication to patients, to consumers, to practices, whether it's in oral health or other fields that could help oral health and oral health literacy?
Well, I think I mentioned journalism before. And, in my previous life, I was at a university with a school of journalism. And, I think that that's a field we can learn from to more effectively communicate information to both consumers and patients. Really great journalists are very adept at taking very complicated messages and sending them out to the masses. And in order to be a good journalist, you have to be truthful, you have to have public interest at heart, and a commitment to the citizens that you serve. And so I think their ability to take very mundane facts and to put them into an interesting format and make it relevant through really good storytelling is something that we can all learn from. I mean, if you think about it, right now there are 3.5 billion people in the world with oral health disease. And, we spent a lot of time, Dr. Holland talked, I'm used to be a practicing periodontist. So I love my patients. My conversations with my patients were all about providing them with information to enable them, et cetera, empower them. But 50% of people in this country don't even go to a dentist. They don't get into a dental office. So we have to think about how we're going to address these issues for the broader population and improve on oral health literacy, because clearly it's not very good when we look at the broader population, when you have so many people suffering from oral conditions. And if you think about the recent World Health Assembly historic resolution on oral health through the World Health Organization, I mean, there was clear agreement within that oral health should be firmly embedded within the non-communicable disease agenda and that it should involve oral health or include oral health interventions within universal health coverage communications and programs. And so it's really important that, yes, we have this great opportunity when someone is in the office to educate, to empower, to teach, but so many people are not provided with that opportunity. So if I think about other professions that could help us, I do think about journalism and getting the message out to the masses, which is what they're used to doing. And I think we have to really work with them to share these important messages.
That's a great point. Dr. Holland, do you have anything to add to that?
No, I would absolutely agree. I would look to journalism for the reasons Dr. Ryan stated, storytelling for sure, and the skill that comes along with that, but also just the field of marketing. They don't, I mean, if you've got a good marketer, they know how to similarly tell a story, get buy-in, and affect behavior change, right? Like, because ultimately that's where we want to go. And I know health literacy is not quite at the behavior change piece, it's a little separate, but it's getting there, right? So what is it that health marketing can do? And sometimes that can be a negative phrase, but I think it's the sense that the lessons learned from the marketing field, I think, are that they study their audience, right? They know who it is that they're talking to. They study them, they know the desires, they know, how they might identify, they know their needs, their wants, their beliefs. I think that's something that we have to better integrate into oral health so we can identify, okay, where can we meet our patient? Where can we meet our communities? Where can we meet the populations where they are? So at that point, we can start engaging in real conversations and in real actionable ways that will be really reflect what it is that our communities are needing. So I think knowing your audience first and foremost, and marketing does a fantastic job of that. Journalism does as well. So
I think we have a great real-time example this week in that William Shatner went to outer space, and a lot of the news coverage was about what a great marketing coup that was for Blue Origin to do that. And I also reflect on all of the TikTok popularity and videos that have been putting out information that was actually harmful to oral health. We've all heard and seen those examples. And then you have the health community putting out a don't do this, don't do that, just because you saw it on TikTok. And I think about even how my own parents get information. My mother gets a lot of information off of YouTube. And so people might not think that someone in their 80s is getting social media information, but there you have it. And I'm finding myself trying to supplement that with other channels. So how can we think more creatively? How do we take a white paper that was read by a specific target population and get that information to out in different channels? And so I think conversations like these are one way, but how do we go to the next level? How do we engage with those vehicles of communication that are more popular these days and that are easier and more functional to those communities? So I think journalism, marketing, social media, those are all examples of how we need to be thinking, because that's how people are actually absorbing and getting information. And if we're not doing it with accurate information, others are doing it with inaccurate information, and then you feel then it's a bigger hurdle to overcome, because now you're starting at a place where you're fighting some of that misinformation, which is what we're seeing in healthcare as a whole. I wanted to, as we close up our conversation, we've touched on some great topics. We've touched about the system, the context, the importance of oral health to overall health. We've talked about health equity and the disparities and why it's important to have oral health literacy across a number of different populations, and the role of different organizations and companies in promoting good oral health. As takeaways, as you think about how we want to leave our viewers with this topic, what are some takeaways that you want to leave behind? What are some important things to note about why oral health literacy is relevant? And what can I, as a viewer, take away from this conversation that will enable action to improve the oral health outcomes of our country? And either one of you.
You want to go first, Nicole?
Sure, I'm happy to. So I can think of three quick things. I think a key takeaway that we didn't have too much time to discuss, but I just want to state is that when we think about issues of disparities and social determinants and equity and health literacy, there are a lot of terms thrown around, particularly in academia, right? But to be clear, I think the goal really is impacting health, overall health, which includes oral health. And we want to have an equitable society as it relates to health and healthcare. And so health literacy is a part of that. You can't have health equity without health literacy, right? You can't have health equity without oral health literacy, because oral health is a part of that entire conversation. So I want to be clear about that relationship, that health literacy is a part of health equity when we think about long-term goals and what it is that we're trying to do. I think another takeaway for me in terms of making it actionable is that the beauty of oral health, as Dr. Ryan was, talking about earlier, and this is what struck me very early on in my career, it touches everybody at every stage of life. That's amazing. There are so many entry points that we have as a profession that we can really, again, get to know our audience and see what ticks and works for them. So I think we have an opportunity that many other disciplines don't have from a healthcare standpoint, because again, we touch every single aspect of life, either whether it's prevention or whether we're actually dealing with disease. But I think we have opportunity there. The other piece that strikes me, and what I tell my students all the time, is if it's true that the majority of dental diseases are preventable, which they are, why is the disease burden so high? And what can we do about it? And we're starting to answer that question here. But, and this is my last takeaway, you can do health literacy related things wherever you are, right? So similar example in leadership, where it's you lead from where you are, right? You involve your sphere where you are, whether you're a dentist, whether you're a patient, whether you're a caregiver or a family member. There are so many small ways in which we can have influence, right? So if we do see misinformation, which is just rampant right now, what are the ways that we can combat that in a way that's constructive, right? So if we are a dental practitioner and we don't want to, make our own patient education materials, perhaps then we'll just scrutinize a little bit more the ones that we're purchasing. Are these culturally and linguistically relevant for the population that I serve? Do I fully know the population that I serve, right? So there are things that we can do where we are, where we're not asking you to, stand up in front of a crowd and make a speech or, buy a whole bunch of stuff in order to implement change. There are small changes that can be made and tweaked wherever you are leading from. And I think that's the biggest takeaway for me about health literacy and communication in this space. So thank you.
Yeah, I agree, Nicole. I think it's really all of us. It takes a village to make this happen. And I think that you have to, provide trusted sources. I really, we've really taken a lot of time to curate our Colgate.com website, the Oral Care Center, with hired professionals to ensure that the information is accurate, that it's updated. We've made a tremendous effort not to have any commercial content in it. And so we really want to just help people to find the answers they're looking for. And we get millions and millions of hits. So people are looking for those answers, oral care tips, oral hygiene guidance. What does this swelling mean? What does that mean? Just helping to answer the question. So, we're looking to make this like the WebMD for oral care. And we've invested a tremendous amount into this particular site. Our Bright Smiles, Bright Futures site is, for a program that's been around since 1991. We've impacted the lives of more than 1.3 billion children by providing oral health education and screenings in over 80 countries, providing materials in over 30 languages. And the materials are not just for kids, but for school teachers, for their parents, for everyone, because, if they don't have the role models, they're not going to do it themselves. So it's really important that we not only teach the kids when they're young, but that we get the role models also involved in this to really have a true impact. And we have a goal to reach 2 billion children by 2025. And we're we'll believe we're going to get there. So I think that we need to continue to do all of this, but, and you know, Vivian talked about, you know, the ways that people communicate, you know, online is one way. The other thing we're doing is we're developing connected technologies, both manual powered, to make it fun, interactive, provide tips, provide hints. You know, one of the things we talked about is what's important to different people. Why they may want to take care of their oral health can be very different from one individual to another. And we have to think of the behavioral scientists. How do we motivate people? Some people, you know, they'll tell you, I didn't get that job because I was interviewing and I had missing teeth and I need to take care of that. Kids will talk about the fact that they are bullied or they're depressed. They don't miss days of school because of oral care problems. And how do we motivate the parents and educate them that that doesn't need to happen? You know, a lot of these things do not need to happen. And if you think about the workforce in general, many people miss days of work because of oral care issues. So does it motivate them that that needs to be addressed? Not just that I have a bright smile and my teeth are white, but what is the motivating issue for you? And then we can get people involved. And the only way we're going to really know that and kind of tailor our messages is by having a two-way conversation. So we really have to understand from people, as I said, what their OQ is and what's going to drive them to improve their OQ. So their oral health quotient. And those conversations are going to help us to reach out to the broader population, because there are so many people who really are not getting the care that they need. And clearly, oral health literacy is not where it needs to be, because if it were, then we wouldn't be hearing these numbers, like 3.5 billion people in the world with oral health problems. So we need to figure this out. And I think that conversations like this, breaking down silos, bringing together business, academia, the insurance industry, government agencies, that's how we're going to make progress. Doing it in silos, we're going to get stuck. And I think we've done that for quite some time. So it's really exciting to be here with all of you, because I think that's how we're going to make progress.
Okay, well said, both of you. When the Institute was founded, one of the priorities from the beginning was always oral health literacy. Our leadership felt that this was very important for us to fulfill our mission of oral health and good overall health for all. And that's something that we're trying to do each day, both through our research and through our convenings. And as you say, bringing all of these sectors together. When I reflect on this amazing conversation, I go back to the beginning, the fundamentals of what is literacy and how important oral health literacy, it's as reading is to our life, right? How incapable we are of fulfilling some of our goals if we're unable to read and write at a certain level, and how much emphasis is put on literacy in order to achieve overall life goals. I think the same about oral health literacy, right? If we're going to live our best lives, whether it's work or school or having that bright smile, it's about having good oral health literacy. It's a fundamental building block to our healthcare. And so ensuring that we're able to get these resources out and having these conversations. We'll be on social media with this conversation series, and hopefully we can have some two-way engagement through that as well. But again, wanted to thank you both, Dr. Holland, Dr. Ryan, for your insights, for all of your contributions to the field over the last few years in this space. And thanks to our viewers for joining us. If you'd like to learn more about oral health literacy, you can visit the Delta Dental Institute website, follow us on Twitter and Facebook. Wanted to thank you all and have a wonderful day.